Call the member for Wright.
And I thank you, Deputy Chair, and acknowledge your new position here in this House. There are people in this place that one tends to model themselves on, and you find that there are good men in this House, good men and women. You have displayed statesman-like qualities, and of those qualities I have tried to emulate myself on, and I praise you for that. For your contribution and ongoing contribution to the House, due recognition has been bestowed upon you with the recent election of your Deputy Speaker, and I acknowledge that a position well fitted. Deputy Speaker, I rise to speak on the Dental Benefits Amendment Bill 2012 that is currently before the House. And the bill makes amendments to the Dental Benefits Act 2008, changes that don't assist people who are in need of dental services right now or those undergoing current treatment plans. A change that is designed to give this Labor government its own authorised dental scheme. And we, the Coalition, would not mind so much if the bill actually improved the scheme that the Coalition under Tony Abbott, as then Health Minister, presented to the Australian people, and that has been delivering dental services ever since. The previous Speaker, Mr Deputy Chair, made reference in his speech about those people who could least afford dental care. One of the flaws in the bill that's currently before the House punishes the very people that he was claiming to represent. This bill, in its entirety, affects those people who can least afford it, because it creates a gap between when the government scheme is proposed to come in and leaves a void which none of the speakers on the other side are mentioning in their speeches. And I think they're not mentioning it because it must be evident that their electorates will be affected by this oversight. This government has, in an explicit wisdom, chose to delay the start of the program to January 1, 2014 for children and July 1 for adult treatment, but then closed the current program on 30th of November of this year. So that's quite a gap, as will be the gaps in the mouths of patients requiring dental treatment right now. During and up to the start of these dates, some 13 months for children and 19 months for adults. Now, that is inexcusable with a country when we have a Treasurer on the floor of this Parliament stand and boast about how wealthy we are and how great the country is fiscally and what strength we have. To have a class of person in our society, in our community, to have had dental care taken away from them, depending on your age demographic, for up to 19 months. And Deputy Speaker, let me say that I'm not surprised that the Australian people and the people of Wright, who I represent, have little or no choice but to suffer yet again by this government's hasty policy tactics. These hasty tactics, Deputy Speaker, of rushing this bill through the Parliament without providing the appropriate details, it does nothing to help this Parliament, this country, put into action clean, healthy policies that only prove that this government's contempt towards the Australian people. It seems somewhat ironic that we were looking at an issue of health and yet the government can't even exercise healthy methods of policy development. We have a government with such a contempt, Deputy Speaker, that they've decided it's good policy to close the Medicare Chronic Disease Dental Scheme on the 30th of November of this year. A service that has provided some 20 million services since 2007. Not to mention that no new patients were able to access services after 7th of September, leaving a 13-month gap in the availability of services. 13 months of being left in the dark, 13 months of Nurofen, cold packs and what other remedy patients could find to soothe their abscesses, their broken tooth and various other dental ailments children suffer. Now, I know that it was probably not the intention in this bill. Mr Speaker?
Order. The member for Shortland, the member for Wright will resume seat. The member for Shortland.
I wish to ask the member a question. I wish to make an intervention.
Would the member for Wright take a question from the member?
Absolutely.
The member for Shortland has the call for a question to the member for Wright.
Thank you very much. I'd like to ask the member for Wright what assistance is available to those people at the moment that don't qualify the chronic dental health program, and how will his government help those people that have been on the waiting list for sometimes in excess of 10 years?
Thank
The member for Wright. The member for Wright has the call.
I thank the member for their question, and hopefully those answers that I will provide those answers during the course of this address. And quote to the Health Minister, who states in her news briefs on the ALP website, Labor believes we have a responsibility to ensure that Australians who are least able to afford to go to the dentist, and particularly children, should be given access to government subsidies oral health care. Well, that's great to have that there, but when they say that they should be given access, that should be qualified by saying access today. It is not qualified by saying given access at some point in the future, once we get our fictitious surplus put together, once we go back and try and find the savings in a budget which we have wasted billions of dollars. This is the unintended consequence of poor management. This is the unintended consequence when we have families in lower socio-economic sectors which are being punished under the auspice that millionaires have access to this. Now, I actually rang one of my local dentists in my electorate and said, how many millionaires do you have come in and take advantage of the chronic health disease? And he laughed at me. He laughed at me and he said, you're kidding. He said, millionaires have their own health insurance and they don't come here to regional Australia, to regional Australia to get dentistry work done. So the argument that's put up by this government that the measures that are being proposed for changes are in a way to try and block millionaires getting access to this is nothing short of farcical. Well, Deputy Speaker, there's no access for 13 months for children, there's no access for adults for 19 months, and that's shameful. Deputy Speaker, I consider it only fair that the Minister for Health should explain why these children must suffer without dental care for up to 13 months and why adults should suffer for 19 months, and furthermore, how does this government propose to actually deliver on its unfunded 2014? I suggest it's just because of a blind obsession to try for a money grab, a blind obsession by this government for a money grab to create the surplus. Not happy to take food out of the mouth through increased taxes of the Australian public and take food out of the mouth of mums and dads of my electorate, they are now delivering a cruel blow of delivering a bowl of fruit into the front of someone who, with no teeth, that is unable to eat them. Perhaps members on the other side of the House have not had to suffer in the pain of going, without going to receive dental treatment. Perhaps members on the other side of the House should take a Nurofen or a Panadol next time they have an infection and see how long they'll last in the absence of dental care under their scheme. I had a lady in my electorate, and for the sake of security, her first name was Erica. She lived on Mount Tambourine. She called me at 9 o'clock one night. I happened to be up there on the hill, and she said, Scotty, I'm in a heap of pain, can you come round? So I went around with my Chief of Staff, who had spent some time as a dental technician. This lady had a mouthful of abscesses. She was in a heap of pain. The very next morning, we got her down to the local dentist. We got her elevated through because of the chronic pain. She took a series of antibiotics, and then under the chronic scheme, was able to apply for a set of false teeth, which enabled her to be able to return to some type of healthy eating habits. After 30 November, that lady will have to suffer. After November 30, Erica would not have access to the chronic dental scheme. Deputy Speaker, I really hope that Nurofen lasts longer because lasts enough, because for those in chronic dental conditions, the loss of $4,250 in dental fees over the 2 years is going to be a painful experience. We're talking about a scheme that's provided approximately 20 million services to more than 1 million patients since 2007. The Medicare Chronic Disease Dental Scheme, introduced by the Coalition in government, has been an enormous success. And yes, there has been overruns. Absolutely. The overruns have been a result of the amount of people taking up this program. It is the only Medicare dental scheme that has provided treatment for adults, and it's been very successful at that. The scheme that was conceived by the current Leader of the Opposition, Tony Abbott, that started by placing the needs of the sick first And now we have a government that's doing everything that it can to increase the sale of Nurofen and Panadol. And despite claims of its expenditure blowouts, the average claim per patient, according to recent figures from the Department of Health and Ageing, is that it's $1,716 per unit, well below the allowable $4,250. Deputy Speaker, it's even more disappointing knowing that the Coalition's offered to work with the previous Health Minister to refine and improve the new scheme, including through a process of providing high-cost items when needed, such as crowns, bridges, were rejected. Now we move on to the replacement scheme for the National Partnership Agreement for Adults Public Dental Services. But, Mr Deputy Speaker, let me make it absolutely clear that there are very important facts about the current situation facing the dental health system at the moment. Under the new scheme, services will no longer be available for adults through private dentists under Medicare. At present, we have 650,000 people that are currently on the public dental waiting lists, 400,000 of these adults according to the government's own figures. 400,000 people, Deputy Speaker, that this government are going to forget. Even if it doesn't deliver on its funding, promises, the state government, the cutting of the chronic disease dental scheme and the delays in delivering the new commitments is likely to lead to a deterioration of waiting times for public dental patients. And yet, disturbingly knowing this, the government continues to maintain its position to close the chronic disease dental scheme. The current scheme has provided approximately 20 million services again, including 7 million in the last financial year alone, and yet we have a minister who said that the plan will only provide 1.4 additional services over 6 years, or 20% of what the chronic disease dental scheme provided last year alone. Deputy Speaker, the facts speak for themselves, and I've done the maths and it just doesn't add up. Playing politics with the Australian people's health is a dangerous game for the well-being of the Australian people, a dangerous game with the well-being of the people of Wright, who I have their best interests at heart. And for the record, Mr Speaker, it's clear to those on this side of the House that this government is very clear that creating a gap in treatment for patients is an attempt to deliver on a much-promised surplus, the surplus that they would rather invent at the expense of health and well-being of the Australian people. And just before I finish, Deputy Speaker, I want to emphasise the Coalition's position on this issue by stating for the record that the Coalition clear support and strong investment in dental health in the past. I know for myself, I'm explicitly concerned about knowing that thousands of children, in particular those who will lose access to the treatment on the 30th of November with the closure of the chronic disease dental scheme. These are the children, Deputy Speaker, and I know that they're on, and how those on the other side of the House believe it to be a sacrifice for the health of the Australian future is a serious matter. It is without doubt that the government's actions suggested is more about the politics than the issue of the policy. The government's vague promise at some time in the future of providing money to the states and territories for public services is just not good enough. Unsurprisingly, at some point in the future. And where that money comes from at some point in the future, there's no caveat on where that money is coming from. There is no mention of what services will be cut on the Australian landscape to provide for that. There is no mention of what services will be cancelled that are existing, those that are already under stress from an interest payment that the federal government is having to come up with an extra $6.8 billion a year, an expense that was never in place when this government left office. Will they cut from the pensioners that can least afford it because they have form on that? Will they cut welfare? They have form on that by putting extra expenses on families through increased taxes through their electricity bills. This government has gone to great lengths to undermine the scheme because it was established by Tony Abbott as Health Minister, and it's been a success in improving access to treatment. I know for sure that people in my electorate are tired of waiting for good policy from this government, and now for those who suffer with chronic dental health problems, they are literally going to have to suffer pain for a lot longer. I want the Australian people to know that the people of Wright in particular, that those on this side of the House are doing everything that we can to protect their dental health and deliver funded programs. Thanks, Mr Speaker.